Did you know that what you eat can be affecting the health of your gums even more than your toothbrush? A new study suggests that what you're eating, especially if it resembles a Mediterranean diet, can help lower gum disease. But is that actually true? This can be a big deal, since gum disease isn't just about the health of your mouth. It's also linked with other systemic diseases like heart disease, diabetes, and even premature birth. So it's not really just about the health of your teeth and gums, it's also about the health of the rest of your body. So let's break down what this study actually found and what it actually means. Gum disease affects about 1 billion people across the world. I know that might seem like a big number, but I wouldn't be surprised if it's actually more. You see, anytime anybody has bleeding gums, it's usually a sign of gum disease, or at least the start of gum disease. Now, the Mediterranean diet is already super popular and famous for health and longevity. So it makes sense if something is already healthy for the rest of your body, it should be healthy for your teeth and gums too. Now, I know I said that gum disease starts as bleeding gums, but it is a whole lot more than that. Gum disease also means you have inflammation, and if it's systemic inflammation, it means it affects the rest of your body. And this is how it can contribute to those other diseases I talked about. It also doesn't just stop at bleeding gums. If gum disease gets worse, it can start to affect the support structures of your teeth. This is when it turns from something called gingivitis into periodontitis. Now, periodontitis is when it doesn't just affect the gums, it also affects the bones and the ligaments that attach your teeth into your jaw. This means that as this periodontitis gets worse, not only will your gums keep bleeding, but now those support structures will start to go away. You'll start to lose those ligaments that attach your teeth to your bone. You'll start to lose that actual jawbone that holds your teeth in. And eventually your teeth can get looser and looser. And this is the #1 reason that people end up losing their teeth. So if your gums are bleeding when you're brushing and flossing, that is not normal. Now let's look at the study. This study was looking at 195 patients in the UK. The main finding was people that eat more of a Mediterranean diet, and these are things like fruits, vegetables, olive oil, and legumes, had fewer signs of gum disease. They also had lower levels of inflammation in their blood. These are markers like IL-6 and CRP. Now, on the flip side, people eating things like red meat and fewer plant-based foods actually had worse gum disease. Now, at first glance, this might not be super surprising, right? Because people who tend to eat healthier might also have healthier practices. People that eat healthier foods might be more likely to brush and floss their teeth, and people who eat more unhealthy might be more inclined to just not take care of their teeth. But at the same time, diets that are rich in whole foods, plants, and healthy fats will help reduce inflammation overall. So that reduction in inflammation could also be one of the reasons why your gums can get healthier. Now, I just want to be clear, this study is not showing any cause and effect relationship. It's just showing a link with eating these healthier foods and having less gum disease. But to be honest, it would simply make sense if your diet plays a much bigger role than we would initially think. Because even when it comes to cavities, like the health of your teeth, your diet plays a bigger factor in the cause of cavities, like these holes in your teeth, even more so than brushing and flossing. And that's because when you eat these sugary carbohydrate foods, they will feed the bacteria in your mouth that cause cavities. And in turn, these bacteria will poop out acids and cause these holes to form in the teeth. So if you're frequently eating these carb-heavy foods, you're going to be at a much higher risk of getting cavities, even if you do brush and floss your teeth. Now, I'm not saying that oral hygiene isn't important, like brushing and flossing are still super important. But so many people do those things but still have gum disease. So next time you're thinking about what to eat or what to get from the grocery store, try to remember the results of this study. And you can even make simple switches too, like instead of using butter every single time, you can also try using olive oil once in a while. You can also try adding more beans and legumes to your diet, and instead of snacking on like chips every single time, maybe try snacking on fruits or nuts. But the bottom line is you still have to brush and floss your teeth and do all the basic things like going to your dentist every 6 months. Because our diets, no matter what, are going to be different from our ancestors. Our ancestors didn't really have as much gum disease as we do now, and a big part of that is because of the changes in our diet. So even if you're focusing on eating a Mediterranean diet, you're still probably going to build up more plaque and bacteria on your teeth, so it's still very important to do the basic things. Anyway, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. You might walk out of your dentist's office totally relieved that you don't have any cavities. But here's the scary part. There might be something totally worse lying underneath your teeth that you're totally ignoring. You see, most people don't realize that the #1 reason that people lose all of their teeth and end up in dentures isn't because of cavities. It's because of gum disease. Today I'm going to show you why your gum